Hello, Dr. Vikki Petersen here. A reader writes, she lives in Spain right now, and she's American that's moved to Spain. She has an interesting story in that she has a lot of celiac disease in her family. She personally had suspected she was gluten sensitive. She always had digestive complaints that occurred, diarrhea, bloating. It would last for 3 days every time she consumed gluten. And she kind of made the assumption that she had celiac. There was so much in her family. She was obviously sensitive herself. But she recently had an endoscopy done, and she has waited 9 months in the Spanish system to get the results of her test, which makes me shiver and cringe, but there you have it. And she wants to make sure that she asks the specialist all the questions she possibly can, because it's so difficult to get doctor's visits in Spain. So really what it comes to is this endoscopy going to be the final piece of information she needs, and what does she do based on what she hears? I recently spoke somewhat on this topic from the viewpoint that we need to understand that the gold standard for gluten is that someone removes it from their diet and feels appreciably better. And it's your body, you know how you feel, and if you eliminate gluten from your diet and you feel better, that is a positive test right there. Nothing further needs to be done. Now, an endoscopy, which I'm assuming included a biopsy, meaning they were looking to see if the villi of her small intestine were eroded, which would occur in celiac disease, would certainly tell her if she had celiac disease or not. But if she does not have celiac disease, does that mean she's good to go and eat gluten? Her body's already told her that's not the case. She gets severe symptoms when she eats any gluten. She has also been getting a lot of digestive symptoms, which is what prompted this endoscopy to occur, probably from hidden gluten. She might be sensitive to dairy products. She might have a secondary infection of her intestine, which is very, very common in those of us sensitive to gluten, whether it's a parasitic infection, a bacterial infection, overgrowth of yeast, not the correct balance of good bacteria or probiotics in the intestine. All of these things need to be addressed. But if that endoscopy is negative, it certainly does not give her a go-ahead to eat the gluten that she already knows she does not do well with. And I think that's the important point to note, is that while an endoscopy would be helpful to show severe villus atrophy, the negative endoscopy does not mean that someone is not gluten sensitive at all. So I think the important thing to take away from this is your own personal reaction. We do have the immunoglobulin blood test and saliva test. There's also a stool test that can be done, all of them looking at a reaction of your own immune system to that protein gliadin found in the grains wheat, rye, and barley. And that's what's important, is to do some kind of test, but the immunoglobulin tests are not as sensitive as they should be, and false negatives do occur rather regularly at this point. So once again, that gold standard is the elimination and provocation, meaning you've eliminated gluten for a good 30 days from your diet. And sometimes you don't even need to provoke, because you've eliminated it and you feel so much better that you already know. Sometimes that provocation happens by accident. You're trying to avoid gluten, but it sneaks in and you have a reaction. And do realize that the vast amount of time those reactions are not digestive in nature. One would typically think that a food that you're reacting to would cause a digestive response. It certainly can and does, but only about a quarter to a third of the time. So a full 3/4 to 2/3 of the time, it is a non-digestive response. Fatigue, headache, depression, joint pain, as many systems as you can name from the human body, they are known to be affected by gluten. But the nervous system is the second most common after the digestive tract. So I hope this was helpful, and until next time, I wish you very good health.